Good evening to all. Today's medical term that we'll be discussing is cryoprecipitate. What does this word mean? It's product, a product known as anti-hemophilic factor, cryoprecipitated anti-hemophilic factor. So that means it obtained from the plasma, a plasma derived product full of clotting factors. So, definitely, it is going to be used as a treatment for individuals suffering from clotting factor deficiency, right? Uh, Probably the technique that is used to obtain this particular product is a cryoprecipitation technique, all right? So, who are the people who suffer from clotting factor deficiency? There are so many clotting factors, but especially the clotting factor, the fibrinogen. When people have less number of fibrinogen, that is hypofibrinogenemia in the blood, they are provided with this cryoprecipitate. But in adults, we don't have to check the ABO, that is a blood grouping compatibility, because the amount that we provide is very less. But in terms of neonate, that is newborn children, if they have to be provided with this cryoprecipitate, ABO compatibility have to be checked. So, what does this product mainly contains? As I said before, fibrinogen, the key clotting factor, along with factor 8, especially to treat hemophilia A condition, and the von Willebrand factor, which will help the platelets to aggregate, and factor 13, which is a fibrin stabilizing factor, along with fibronectin. So, how do you prepare this? You take the fresh frozen plasma, thaw it at between 1 to 6 degree. Clotting factors will precipitate, separate the supernatant, resuspend it in residual plasma, and freeze it for minus 18 degrees centigrade. So, how much do you give to the patient? Usually, 5 to 10 single units would increase the fibrinogen by about 100 milligrams per deciliter. So, as I said before, it is used for people who have less number of fibrinogen or suffering with massive hemorrhage, disseminated intravascular coagulation, even congenital afibrinogenemia. There is a risk. Sometimes people will suffer from allergic reactions or even transfusion related acute lung injury, even circulatory overload due to the excessive amount of clotting factors, or even blood-borne infections. Nevertheless, it is still a good technique.